Welcome to this unplanned video discussing the structures of the eye. Studying ophthalmology involves good understanding of the anatomy of the eye, good knowledge of the different structures of the eye. The eye is a ball, it's called the eyeball, and has specific structures that we'll be discussing shortly. But we need first to start with the extraocular structures, or what we call the ocular adnexi. Ocular adnexi are considered the accessory ocular structures that are located outside the globe itself, located outside the eyeball. Number one is the eyelid. We have the upper eyelid and the lower eyelid. This is not simple skin. It's formed of 5 or 6 layers. Skin, fat and fascia, submuscular space, tarsus, the skeleton of the eyelid, and lined by the conjunctiva, which is number 2 in the ocular adnexal structures. Conjunctiva is a semi-transparent membrane that starts from the margin of the eyelid, lines the eyelid, forms the fornix, and reflects upon itself to cover part of the eyeball and ends at the limbus, the junction of the sclera and the cornea. So the conjunctiva has 3 major parts: palpebral conjunctiva, lining the inner side of the eyelid; the fornix, which is a reflection, superior fornix, inferior fornix, lateral fornix, and the medial fornix in some textbooks. The third part is the bulbar conjunctiva, which is covering the sclera. Along with the conjunctiva, we have Tenon's capsule. Tenon's capsule is a fibrous connective tissue lining the eyeball from the front to the back. Fourth ocular adnexal structure is the lacrimal system. Lacrimal system consists of the secretory system and the drainage system. Secretory lacrimal system is formed of the lacrimal gland and accessory lacrimal glands. And the drainage system consists of the pipelines draining the tears from the surface of the eye. It has several structures like the punctum, canaliculi, nasolacrimal sac, duct, and the duct drains into the nose. Number 5 is the bony orbit, which is the bony envelope of all these structures. The bony orbit is the envelope that contains all these ocular and extraocular structures. And number 6 are the extraocular muscles responsible for movement of the eye. Each of these ocular adnexy has congenital disorders, has inflammation, tumor. So you need to be aware of these ocular adnexal structures. Now we move to the eyeball itself. So the eyeball is this ball, consisting mainly of 3 layers or 3 coats. The outer coat, middle coat, and innermost coat. The outer coat is called the outer fibrous coat. The fibrous coat forms of anterior 1/6. This is a cornea. And posterior 5/6. This is a sclera. This is a cornea. It's like a water glass. It's the front cover of the eye. The function, it's responsible for focusing the light on the retina. It's formed of avascular, clear, transparent tissue that allows light in. While the posterior 5/6 are vascular, opaque, and it's called the sclera. Sclera is a protective outer fibrous coat of the eye, and it gives the eye its shape and protects the contents of the eyeball. Diseases of the cornea are very important. It might be congenital, like congenital hypertrophic endothelial dystrophy, leading to corneal opacity, which is opacification of the naturally clear or transparent cornea. And this leads to preventing light from entering the eye or being focused on the retina. Might be inflammatory, which is called keratitis, and it's very common to have infectious keratitis following contact lens wear, which is a very dangerous disease and needs to be addressed and treated promptly. Trauma might lead to corneal abrasion and erosions, which is very painful. And as a multidisciplinary approach to the ocular surface, lesions with the lacrimal gland and the conjunctiva and the eyelid can lead to abnormal distribution of tears on the surface of the cornea, leading what's called the dry eye syndrome, which is very common, and very extensive scientific work has been to this arena. The scleral tissue is very similar to tissues in the cartilage and joints. So scleritis most of the time is not infectious. It's very commonly related to autoimmune diseases. Even common diseases like arthritis, like rheumatoid arthritis, it affects the sclera by what's called scleritis. This is the first coat. It's called the outer fibrous coat, cornea and sclera. The second coat is the middle vascular or nutritive coat. It's called the uveal tract. Uvea is grape, and it's called uveal tract because previously, when the sclera was dissected and anatomists just held the eye from the stem of the optic nerve, it looked like a grape, so they called it the uveal tract. The VL tract here, it is a red structure sandwiched between the yellow structure and the white structure. It starts from the back as what's called the choroid, and it's lining the inner surface of the sclera. In this area, it bulges and forms what's called ciliary body, and the ciliary body has an attachment which is called the iris. Of course, because the eye is a ball, and this is just a longitudinal section of the eye, you can imagine that it's rounded all around, so it's covering the whole inner surface of the sclera, which is like a ball. But because we are cutting a longitudinal section, it appears as a line. And you can understand at the moment why the iris is a diaphragm, is a circular area, and when cut, it shows as two lines with the pupil in the middle. So the middle vascular layer is the choroid posteriorly, ciliary body, and iris. In the middle of the iris, as a diaphragm, there is an opening called the pupil. Pupil is like a diaphragm of a camera. It controls the amount of light entering the eye, and has many neurological and systemic diseases affecting the function of the pupil. Simply, if light strikes the retina, stimulates the brain sends impulse back to the iris, asking it to constrict, to narrow this circular opening, in order to limit the amount of light entering the eye. So, in oversimplified words, if the optic nerve is damaged, this reflex, which is called the light reflex, will not be functioning. And you can also imagine, if you study neurology and find some diseases affecting the brain stem or the brain, stroke, blah, 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 this will be affecting the light reflex as well. The ciliary body has few, we can call it ropes. They are meant to hold the lens in place just behind the iris. The lens is the second optical structure responsible for focusing light on the retina. These are called zonules, zonular ligaments. And again, they are like a diaphragm because the ciliary body is running in a circle. So the zonular ligaments are running all over this circle as well. The third coat is a neurosensitive coat. It's called the inner neurosensitive coat. This is a retina. The retina is lining the inner surface of the choroid, starting from here back to the optic nerve. And the fibers from the retina exit the eyeball through the optic nerve, which is a stalk, transmitting the fibers from the retina, conveying the visual signals from the outside environment to the brain. From here, this is what we call the visual pathway. The retina is a neurological tissue, and it's vascularized. It's supplied by nutrients from blood vessels. What comes to your mind is it gets supply, nutrition, from the middle nutritive coat, which is called the choroid. But in fact, only the outer half of the retina gets its nutrition from the choroid, while the inner half gets its nutrition from what's called the central retinal arteriole. So these are the coats of the eye: outer fibrous, middle nutritive vascular, inner neurosensitive. There is an optical structure, which is the lens, which is not one of any of these three coats. So what's inside these cavities? Let me tell you. First, from the posterior surface of the cornea to the anterior surface of the iris, this is called the anterior chamber. And from the posterior surface of the lens to the anterior surface of the retina, this is called posterior segment. Not the posterior chamber, posterior segment. And from the posterior surface of the iris to the anterior surface of the lens, this is called posterior chamber. So we have two chambers, anterior chamber and posterior chamber, and posterior segment. Anterior chamber and posterior chamber collectively are called the anterior segment. So the anterior segment is the part from the posterior surface of the lens to the anterior surface of the cornea. This is called the anterior segment. The posterior segment is the part from the posterior surface of the lens to the back of the eye, including the retina and the choroid. Posterior segment is stuffed with what's called the vitreous humor. Vitreous humor is like the jelly of the eye, and it helps the nutrition of the ocular structures and gives the eyeball its shape. This can be removed in a kind of surgery which is called vitrectomy, where we deal with vitreoretinal diseases and retinal detachment. While the anterior segment is a part of the eye which diseases deal with the cornea, keratitis, corneal ulcers, anterior uveitis, anterior iritis, iridocyclitis, cataract, and glaucoma. The anterior segment is filled with aqueous. The aqueous humor is a fluid found in the anterior part of the eye. It's formed in the factory in the ciliary body, secreted into the posterior chamber, flow through the pupil, and then into the anterior chamber, and then it's drained outside the eye. It's drained through this angle. So from this angle between the cornea and anterior surface of the iris, there is an angle. This is called the anterior chamber angle. And this anterior chamber angle has specialized structures like the trabecular meshwork. This is a simplified explanation of the ocular structures and ocular anatomy with a very quick explanation of different diseases. This diagram shows the different ocular structures, including the